Good day, dear friends. With you is Natalia on the Dr. Safkina channel. If you constantly feel cold while the temperature drops below 36.5 degrees, gain weight, and constantly want to sleep, memory deteriorates, appetite decreases, and there is a tendency to constipation. Hair becomes dull and brittle, and swelling appears on the face and legs. It's time to think about possible hypothyroidism. Many of us today are taking L-Thyroxine. Other names are Euthyrox, Bagothyrox, and so on. It is prescribed not only for reduced thyroid function, but also after various types of operations on this organ, as well as in the case of total enlargement of the thyroid and a whole range of other situations. As practice shows, many people feel discomfort when taking this medication. This can be heart palpitations, excessive irritability and anxiety, excessive sweating, and heart rhythm disturbances. In this case, patients often refuse to take this medication, believing that it simply does not suit them. What should be remembered when taking L-Thyroxine so that the treatment does not cause discomfort? First of all, L-Thyroxine should be taken 20 to 30 minutes before eating. And wash it down with a sufficient amount of drinking water. Not with tea, juice, fruit drink, milk, and especially not with soda. Want to emphasize this for your attention. In case you forgot to take the medication before eating, you can do it afterwards, but definitely 3 to 4 hours after the meal. In this case, the daily dose can be divided into 2 or 3 doses. But it is necessary to observe all the nuances of taking the medication that one mentioned, meaning 20 to 30 minutes before eating or 3 to 4 hours after. For elderly people suffering from ischemic heart disease and heart rhythm disorders, a treatment regimen with L-Thyroxine can be suggested, in which it is allowed to skip the intake of this medication once or twice a week. By the way, there is a treatment scheme in which the dose of L-Thyroxine changes depending on the season. In the fall and winter, it increases, while in the spring and summer a lower dose of the drug is prescribed. What should be done if discomfort is still noted against the background of taking L-Thyroxine? First of all, you need to give blood for thyroid hormones, thyrotropic hormone T3 and T4. Having the results of these analyses in hand, it is advisable to consult with an endocrinologist about the selection of the dose of this drug. Having the results of these analyses in hand, it is advisable to consult with an endocrinologist about the selection of the dose of this drug. This is especially true for women during pregnancy. Many of us know that any hormones, including prednisolone and metipred, need to be cancelled gradually, reducing the dose. In the case of L-Thyroxine, the entire dose of the drug is removed at once. Many of you are interested, can L-Thyroxine be not taken in connection with a surgical operation or some other consideration? The drug can be not taken for a maximum of a week. Then it is necessary to definitely return to the previous dose of the drug intake. Some of you are interested in the question, can the tablet be divided with the aim of reducing the dose of the drug? This is definitely not what you should do. Moreover, L-Thyroxine is released in 10 doses. So in any case, you can select an individual dose of the drug. Many patients, due to a number of circumstances besides L-Thyroxine, are forced to take other drugs in their life. You should also remember that taking L-Thyroxine simultaneously with iron and calcium preparations, as well as with antacids, 1-mean Almagal and Malox is not recommended. He just doesn't get along with them. And the difference between taking these drugs should be at least 4 hours. By the way, it is not recommended to take L-Thyroxine together with other drugs. It can affect the metabolism of cardiac glycosides, particularly digoxin, anticoagulants, and Pradaxa and Liquis, Xarelto, certain diuretics, and particularly the metabolism of furosemide, amiodarone, antidepressants, and a whole range of sugar-lowering drugs. In each specific case, it is necessary to discuss the regimen and dosage of taking medications with your treating doctor, providing a complete list of other means used by you during the therapy with L-Thyroxine, which unfortunately is ignored in practice. And how often should the thyroid hormone T3 and T4 be administered during treatment with L-Thyroxine? In that case, if the dose of L-Thyroxine has already been adjusted, the control of the mentioned thyroid hormones should be monitored twice a year. Is it necessary to take L-Thyroxine at all? Is there any way to get by without it? Treatment with this drug significantly improves quality of life while reducing the risk of developing serious cardiovascular diseases. Taking these drugs during pregnancy, according to indications, naturally contributes to the proper development of the central nervous system of the future baby. In addition, a lack of thyroxine leads to a constant decrease in thyroid function, an increase in bad cholesterol, 1-mean its atherogenic fractions. A lack of thyroxine also contributes to an increase in diastolic, in other words, lower arterial pressure, as well as weight gain. The risk of developing ischemic heart disease and possible heart rhythm disturbances increases, and primarily the development of atrial fibrillation. The risk of developing cardiovascular insufficiency and mortality from these diseases also increases. Many people are interested in the question of how long L-Thyroxine should be taken. In most cases, this medication needs to be taken for life, and there are no restrictions on lifestyle while taking it. You can eat as usual, engage in any kind of sport. As practice shows, many of us have come to associate any thyroid disease with a lack of iodine. Yes, iodine is indeed necessary for the production of thyroid hormones. However, with hypothyroidism, our thyroid is unable to synthesize hormones with the participation of iodine. Therefore, taking iodine-containing preparations in this situation makes no sense. Replacement therapy with levothyroxine is necessary. One also advises you to watch this video on how to detect malfunctions in the thyroid gland. Stay healthy, dear friends, and see you soon.